Next session involves laparoscopic intercorporeal knotting. This session will be conducted by Dr. Saeed Ahmed. He is a renowned general surgeon with special interest in laparoscopic bariatric surgery. Currently, he is working as Associate Professor of Surgery in Bariatric Surgery Unit. Please give a warm welcome to Dr. Saeed Ahmed.
Assalamu alaikum, and I welcome all of you. As we have done the first session, which was needle maneuvering, and that was the base of the suturing. If you cannot maneuver the needle and you cannot hold at the proper position, then you cannot move towards the suturing. So it's the basic pillar. And I used to say the needle maneuvering is like needle is like jinn, जिसको जिन बोलते हैं ना. If you have यानी आप इस जिन को अगर काबू कर लेते हैं, then you can move easily, like you can do suturing very easily. So try to practice more and more to hold the needle at proper position. And what is the proper position? It's PX, and the angle should be 110. All the maneuvers which were told you, the basic objective of that was you have to hold the needle at PX, that is towards the swatch, 1/3 swatch towards swatch, and the angle should be 110. If you can hold the needle at this position, then you can do suturing very easily. So try to practice more and more to hold the needle in that position, right? And I would like to deal with, to discuss the next segment, that is knot tying. So basically the suturing has got three parts. One is the needle handling or needle maneuvering at the proper position, then passing the needle through the tissue, and the third segment is knot tying. So I will tell you, I'll discuss with you knot tying, and in the next segment we'll move towards the middle segment, that is how to pass the needle through the tissues. So I will cover the third segment, that is knot tying, and we have done the first, and then in the next session we'll complete, right? We'll do the maneuvering, needle holding, then passing the needle through the tissues, and then third, knot tying. All three things we'll do in the next segment. So in this segment we'll only do knot tying, right? So knot tying is basically, it's extracorporeal and intracorporeal. I will not tell you about the extracorporeal. My topic is intracorporeal, inside the abdomen, right? So it has got three parts. Intracorporeal knotting has got three parts. One is the how to prepare a knot. The first is how to prepare a knot. Second is how to through the knot. And the third is how to secure the knot, right? So you need a good knot, and it should be well secured so that your anastomose shouldn't leak, right? So it has got three components. So first is the preparing the knot, then throwing the knot, and the third is securing the knot, right? So the first and important portion is how to prepare the loop. So in this picture you can see, the first thing is you have to shorten the tail. If you'll keep the tail longer, then it will be problematic during knotting. So you have to shorten the tail, right? So you have to pull the thread so that the tail should be appropriate. It shouldn't be too small so that it can slip. It shouldn't be too long so that it can create problems during knotting, right? It should be of appropriate length. And then you have to take these parallel relationship between these two knots, these two threads, and then make a loop. If you are able to make this loop, this is the preparation of the loop. So the first step is this one, to shorten the length of the tail, and then parallel relationship between these two sutures, and then making a loop, this loop, right? Now you just have to put your this right hand instrument and grasp this tail and then through the knot. So this is the first part. Now this is the second part. Okay, so you have to put your this right hand instrument or needle holder in this loop, inside this loop, and then this is the first through, clockwise first through, then the second clockwise through, because the first knot usually we take two throws, like a surgeon's knot, because if we go for the one through, then there are chances that it will slip, or you will not be able to make a secure knot. So we give one through, then the second through, okay, and now we have to grasp this short tail with this right hand instrument. So this is the first step. So the first segment was preparation of the loop. Now we have to through the knot, first through and second through, and then you have to grasp and try to grasp the tail from the tip or near the tip. If you will like grasp it below or more length, then it will create problem during knotting. Okay, so one through, second through, and then grasping the this tail. So this is the second segment. All right. Now this is the third segment, how to secure the knot. So preparation of the loop, then second is throwing the knot, the third is how to secure the knot. So for securing the knot, you have to cross your hands, right? This right hand, this tail was here previously. Tail was here. So you have grasped this tail through this instrument and then cross your hand. And this grasper will go upstairs and this will come down. So now you can have a secure knot, right? So which we call reef knot if it is single, and we call it surgeon knot if it is double through, right? So crossing the hands are very important. Otherwise, you will have an insecure knot that we call granny knot. Okay, so you have to cross your hands. And what as we are doing during open surgery also, we have to cross the hands. Otherwise, the knot will not be secure. It will be a granny and it may get dislodged. So you have crossed the hands and now you can tight it, right? So you can secure it. Now again, as the first knot has been completed, now you have to repeat this maneuver again 2 to 3 times, right? In the same way. You have to prepare the loop, you have to through the knot, and you have to secure the knot again. So, and again it will be crossed. Now previously this tail was here after the first knot. Now it has gone to the opposite side. So every time, whenever you through a knot, the short end or a tail will move to the other side, right? So when we were doing the first knot, the tail was here, and when we completed that knot, the tail was here, right? Now again, as the second knot is completed, now the tail moved towards the same previous position. Now if you want to give the third knot, again the tail will come back to the downstairs. So every time the tail will move to the opposite side, right? So these are the common mistakes which we do during we may do during intracorporeal knotting. Long tail or loop is not parallel. Like if we leave long tail, then we might end up with this bow. When we tight it, and this tail will not come out, then we might end up with this knot, or there'll be difficulty. So the tail size of the tail should be appropriate. It should not be too long. It should not be too small. If it will be small, it may slip. And it should be parallel, like this. The other instrument should be angulated this way. If both are in same direction, then there will be struggling during the knotting. So if the other one, like as it was discussed before, that the angulation, the triangulation should be more than 60 and it should be parallel. If the angle is short, in it you can see the angle is not more than 60, it's in the 60. So it will be very difficult to tie a knot. So the angulation should be more than 60, right? So these two are the common mistakes which can be seen during this knotting. And these are the different techniques which I told you and discussed you is expert C technique. There are two other techniques, smiley technique and gladiator technique. In smiley technique, when we are short of length of suture, like we have done 1 or 2 stitches and now the length is very short, then you can take help from the needle and hold the needle on the left side and then through the knot, then maneuver the thread. Then it will be helpful. This is smiley technique. When we use needle, usually in the first and second through we were using only the threads. But when we'll stitch 1 or 2, we'll give 1 stitch, then the length of the this thread will become smaller. Then you can take help from the needle to tie, right? That is a smiley technique. And this gladiator technique, in this gladiator technique, we open the jaws of the needle holder while knotting. Usually we close our jaw of the this needle holder stays closed when we take the loops or we through the knot, right? And there are chances in that technique, there are chances that the loop will fall down. When we take first loop and when we'll try to take the second loop, then what will happen? The one loop will fall down. So to counteract that, we use this gladiator technique. In gladiator technique, the jaw stays open, and then we take the throws, so it will not fall. And then we grasp this tail and then complete our knotting. Okay, if there's any question, you can practice now again. So if there's any question, you can ask. If there's any problem, if practically, if there will be any problem, we are there to help out you, and try to practice more and more. These 15 minutes are not enough. As Dr. Mumtaz Mahir told you, that 20 hours practice, more and more practice. You'll keep on practicing. These are not difficult things. It just require practice. These are not difficult things. Just require practice. It's like mechanics, right? You keep on doing it again and again, then it will be very easy. When we started learning our reef knot and surgeon knot by open technique, it was difficult initially. But when we start doing it again and again, it became our reflexes. So in this way, over here also the same principle is applied over here as well. So if you keep on practicing, then they'll become your reflexes. Then there'll be no problem to tie, to knot, to suture, to stitch. There'll be no problem. All right? I would like to show you and demonstrate also how to do this knotting. How to do knotting. not how to pass the needle through the tissue. So this is the loop. The length, I can shorten the length a bit more. Now this loop is prepared. I've taken one through, I've taken another through. Now I'm moving towards the So now the tail was here before. Now I have to move towards the opposite side. To tighten it, you can again. So this is the securing, how to secure the knot. Now this in the same way, we have to repeat the cycle again. Now the tail is here. And now I'm supposed to take only one through is good enough. Yeah, express C loop. So this is square knot, right? So in this way, you have to apply 3 knots, and in this way the whole circle will be completed, right? So now you'll be given again 30 minutes, 15 minutes of one candidate, and you can practice over there over the simulator. Okay? Thank you.
फोल्डर नहीं, यहाँ से नहीं, ये यहाँ से डाला था सर
नहीं पड़ा ना, आप नहीं जा रहे
ये एक दफ़ा पोजीशन करके थोड़ा स्टैटिक करने की कोशिश, इसको एक दफ़ा अपनी पोजीशन बना के होल्ड इस एक हाथ को स्टैटिक करने की कोशिश करेंगे ये वाला हाथ उधर जाएगा, वो वाला हाथ नहीं है, डबल सिंगल है, नहीं डबल। ये वाला हाथ उधर आएगा, नीचे टोटल यहाँ से एंटर, ये वाला हाथ उधर जाएगा।
वो हुआ ही नहीं
जब उठाइए तो
एक काम करो, दूसरे का काम करो तो बता दो। सिर्फ नॉटी प्रैक्टिस कर लो अभी। एक लास्ट पैटर्न सिर्फ 10 मिनट है अभी, क्योंकि हमारा 12 काम है। उसके अंदर टाइम जाएगा, पहले जो अभी से जाएगी मतलब एटलीस्ट फ्यूचर हो गया लैप्रोस्कोपी सुचर है थोड़ी शॉर्ट Yes, well, technically, no, you're at work. तो हमारा बेड अकेले तो हमारा नहीं होगा भाई, ऐसा सारे दिन हुआ ऐसा एक इधर से डाल नहीं नहीं पैरेलल वाली बात तो मैंने बताई थी ना, वो करना अब तुम्हें ये अंदर से डॉक्टर ने मुझे बताना चाहता हूँ ये इधर से उठाओ, ये जो होल है नहीं आप इसी को लेकर वहाँ से इनसाइड सीट डालो नहीं ना, तो ये इनसाइड तो हुआ ये सीट है या अदर जो कैरी उसको तो इसलिए मैंने कहा इंस्टेड ऑफ ये पूरा टाइम में पहले नीडल ही कुछ जो अभी वाली स्किल है वो अभी वाली स्किल ये इसमें ना जूमिंग करने का बहुत हो रहा है ये खुल भी पड़ेगा हाँ बराबर में कोने में जगह बहुत इसको यहाँ ये देखिए ये बम्पर होल्डर उसमें घुमाते बताऊँ ये वाला हाँ इसको राइट